Social determinants of health is a topic that's been around for quite a long time, but the emerging integration of social determinants of health into overall grant funding and clinical care has really emerged. Well, recently, this Neighborhood Atlas from the Department of Medicine from University of Wisconsin School of Medicine and Public Health has been established as a reference for a number of different categories of researchers, epidemiologists, clinicians, physicians, social workers. Basically, living in a disadvantaged neighborhood has been linked to a number of healthcare outcomes, including higher rates of diabetes, cardiovascular disease, increased utilization of health services, and earlier death. So health interventions and policies that don't account for services that are within neighborhood disadvantages may be ineffective. So this Neighborhood Atlas was created to freely share measures of neighborhood disadvantage with the public, including educational institutions, health systems, not-for-profit organizations, and agencies that make it available for research and program planning as well as policy development. And so we're going to go over this and how it works and the basis for using the Neighborhood Atlas. Really, the measure of the Neighborhood Atlas that is most useful is the Area Deprivation Index, or ADI. It's a measure that was created by the Health Resources and Service Administration, also called HRSA. And like I said, it's been around for a long time. So the ADI was created 20 years ago, but it's now considered within this atlas a way to estimate construction and neighborhood disadvantage and actually map the degree of ADI within certain places. And so when we go to mapping, you can map by using Census Bureau geographies, using census block groups or CBGs. And so if we look at the state, we can look at Alabama, and the Alabama map demonstrates where the most disadvantaged areas are, and then can link that with health outcomes. So when we look at this map, we see that the least disadvantaged block groups are in blue, and the most disadvantaged block groups are in red. So it's interactive, and so we can look across and we can see how the demographics change as we go from least disadvantaged. And you see Birmingham being one of the least disadvantaged, partially because of UAB, but you can see it goes from least disadvantaged, and as you scroll across, you can see the differences and how these disadvantaged areas cluster. And we can also look in a few minutes of the health outcomes in those areas. And this is also considered some of the more rural areas as we get to the most disadvantaged groups. And these disadvantaged groups have lower access to health care, lower resources, and as would correspond, higher incidence of chronic disease. And so you could also look at other states with the pull down, and then you can look at the national percentiles and see how that is in reference to the national percentiles. So in the first to 10th percentile compared with the national standards. And again, you see very similar mapping techniques, but this is in percentiles so that it is in coordination with percentiles based on the national averages. And then you can also use this site to download the data, and so that you can have access to the raw data if you enter your email and a password, and the sign up is free so that you can get the raw data for these different areas, and then use that raw data to enact policy, to apply for grants, and for other aspects of public health initiatives. So this release of the Neighborhood Atlas to the public just last week has been a big a big reference point for across the care, cross-sector, interprofessional, and interdisciplinary evaluation of a very important aspect of healthcare. And so with that, we will look at some of the disease states that are associated with social determinants of health as well.